Good afternoon, everyone. It is noon and time for our media briefing. Happy Monday to you. We're going to start our briefing with Karen Smith from the Health Department, who is going to tell us a little bit about an event coming up on Wednesday, a joint press conference with all of our 4 local hospitals. Good afternoon, Karen. And I'm seeing you there. There you are.
I'm here. I apparently have butterfingers. So yeah, so on Wednesday at 11 o'clock in front of the Health Department, we will gather together all 4 CEOs of the hospitals in Monterey County. And it's a very, yes, we know there's not supposed to be any gatherings, but this is an important message due to the numbers of cases that we have, and they felt that it was important for them to come together. So we will be hopefully live streaming that, and it's an opportunity to see really all of us working together, it's pretty exciting. We, behind the scenes, and just for information purposes, we have been meeting as PIOs with the hospitals every week since this began. So this is part of the process. And then if you saw I'll mention a publication, the weekly, there was an ad that's the first joint ad of all 4 hospitals in the Health Department.
Right, and that's Wednesday. Do you have a time for that?
11 a.m.
All right.
11 a.m. at 1270 Natividad. It will be outside. We will be appropriately distanced. There will be X's on the ground for the press to stand so they don't get too close.
All right, thank you. And then just in case there's any questions, please stay on the line after our other speakers have completed, and we'll see if there's any questions for you from the press. Thanks very much. Our next presenter is our library director, Hillary Thayer. She's going to tell us a little bit about how libraries are going to be supporting families during this very unusual and challenging school year that's about to start. Hi, Hillary.
Hi, I've screen shared. Can everybody see my screen okay?
Yes, I can.
Terrific. Okay, so for the Monterey County Free Libraries, I'm just going to cover some of our existing and planned support, both to schools and students, as we're learning more about how the school year is going to start with a remote education. First, this first slide is what is available today. And today, schools and students have access to all of our collections, not just electronic, but access to print, audio, CD, DVD, databases, ebooks. Our full collections, except for our multimedia kits, which involve a lot of hands-on with children, are available today. We also have full access to Research and Reference Assistant, online, email, and phone. The only thing you can't do is walk into one of our branches and work with one of our librarians in person, but you can over the phone or via email or online. All of our branch library buildings continue to have free Wi-Fi, most of them available 24/7, and it's very robust, so you can be outside our libraries in your car, sitting outside the building, and use our free robust Wi-Fi. That is at all 16 of our locations. We also have live and recorded online programs, story times, STEM programs, skill building, technology training, book talks, book groups, arts, technology, and more. And that's available via Facebook, our Facebook page, our YouTube channel, on Instagram, in many different places. So we continue to put out a variety of programs every week. Many of them aimed specifically at students who are doing that important skill building. How do you access during these times? We have a centralized phone number that we answer Monday through Saturday in English and Spanish for any question about the library. That's from getting a library card to accessing a database to describing programs coming up, anything. We have an instant e-card for access. So if somebody needs the online resources and they need them right now, you can apply for an e-card and you will have instant access to those online resources. We can mail full library cards. So if you want access to print materials, we have to get you a full library card. We do that online and put that card in the mail right to you. Our library by mail program is up and running. This is access to our print, audio, and video physical materials. We will mail them to your home, and you can choose to either return them in a book drop or mail them back to us at no charge. That program is fully up and running. ZipBooks is a grant program where if we did not have something in our collection, we can order it from Amazon and have Amazon ship it right to your house. You then just return it in the book drop when you're done. All but one of our locations is doing curbside pickup for holds. So you place a hold on the items you want from the library. It can be 1 item, 2 items, 10 items, 30 items, and designate that you want to pick them up at your local branch. The branch will call you when they're ready and give you the curbside pickup hours and the procedures, and you can drive on by and pick up your items. We've also created something we're calling book packs. So if somebody did not want to place holds on individual items, but wanted items on a topic, they could contact us with their topic. And we would browse the shelves for them and select an assortment of items and have that whole pack ready for them to pick up. So this could be everything from a family just wanting 30 picture books, liking colors, dinosaurs, and trains. And we'll pick them and have them ready. Or somebody wanting nonfiction on a topic, somebody wanting a selection of good mysteries to read, and we're calling those book packs. You can pick them up curbside at your local branch. I want to make sure everybody thinking about schools and students knows about this resource, Brainfuse's HelpNow. This is something we subscribe to. It provides live tutoring and homework help with a certified tutor or teacher in that topic. That is 7 days a week from 1 to 11 p.m. California time, kindergarten through college entry. So this is everything from your times tables through calculus, science, including chemistry, physics, biology, all the language arts, social studies, and writing. This also includes tutoring in Spanish. This includes test practice, including the ACT, SAT, high school equivalency. Students can use pre-planned sets of flashcards or make their own. There's a lot of skill building resources. There's a writing lab in there to send off writing and get some feedback on your essay. And there's a way for students to work together in virtual study rooms. This is all held within this incredible online resource, accessible at no charge with your Monterey County Free Libraries card. And that is either the e-card or the full card. Here's some potential assistance we are in the process of working with our schools on. One is we have equipped all 3 of our bookmobiles to be mobile hotspots. So we're talking to our school districts about where and when they need us, and our communities about where and when they need us, just to roll those vehicles out to enable people to go online by sitting near our bookmobile. We're working with our teachers to build some teacher kits. That would be like a small collection on a theme for a teacher. So if the teacher wanted to do a presentation on endangered species or science projects or ancient Egypt, we would equip the teacher with the resources they needed. We can conduct virtual class visits, online orientations, library lessons with our librarians. We're working on how to do our homework centers on Zoom to create Zoom homework center rooms where our homework center coordinators can help students one-on-one. And we're looking at good partnerships at the curbside grab and go model. So if a school is handing out lunches, grab and go, can we partner and be there at the same time to have people pick up their library resources so that families are only making 1 trip out of the house instead of 2? Here's what we're still planning. We know this is needed. It's on our table. Printing, faxing, copying, scanning. We know people need this. We're actively working on it. How to use a computer at the library or use the library spaces. We do not have any ability right now to have people come into our buildings, but we're working on that. We're also working on literacy tutoring, citizenship assistance. Interlibrary loan would be a lot of those specialized resources we were able to get from our local colleges or other specialized libraries. We're still working on that. Most of our local colleges, their libraries are closed at this time. So that's still a work in planning. I invite anyone to contact us at any time with any questions. Our branch libraries are reaching out directly to their partner school districts to see how they're going to be setting up the year what their schedules are going to be, and what their needs are. I'll paste all this information into the chat for anyone to ask us any questions. And I'm happy to take any questions. Thank you.
Thank you, Hillary. Libraries rock. There isn't anything you can't do. Thanks, and please stand by for questions from our press corps after we complete our other presenters. This wasn't on our topic list, but we are pleased to be able to be joined by Chief Jim Bass from the Sheriff's Office, and he's going to tell us a little bit more about what's happening at the jail. We all are aware of the testing going on there, but there's a lot more information that is available, such as what protocols are in place and some of the challenges about unexpected long-term guests at the jail. Good afternoon, Chief Bass.
Good afternoon, man. Thank you for having me this afternoon. So I'm not sure what exactly everybody's looking for. As you stated, I'll give a general update and overview of what's been going on. Our outbreak essentially started July 6th. We've gone through the process over the last 3 weeks of getting every inmate that is still in custody tested, every staff member tested. I'm happy to report that as of Friday, we have finally completed every inmate being tested. And with that, it's about a 27% infection rate. It's about 195 inmates testing positive out of 713 tests to date. We are going around and strategically retesting areas where we may have had a small number of positives that we had to remove and put into quarantine. Obviously, those that were left in the unit were potentially exposed, and so we're going through the process of going back and retesting those units now. The same with staff. Some of the protocols, I know there's been some questions, and we posted a memo or letter on our website and our app this past week about releases. We've had great partnership throughout this with Dr. Moreno and Christy Michi and their crew, and those at OES in coordinating housing for our inmates that need it, whether it be because they're not able to quarantine it at their place of residence or being homeless or something to that effect. So we continue that. We have deputies that we've selected that's all they're doing one for each shift. They're a COVID deputy, and their job is to help coordinate those releases, investigate information if someone comes in and says that they've tested positive or they've been exposed to somebody that's tested positive. They go back and investigate and research that as well. One of the things we started doing after this outbreak was we had started back in March about separating the inmates that come into custody for 14 days prior to housing them with others. After the outbreak, we actually added a test to that process. Again, public health has been extremely helpful in this process. At day 11, we are testing the individuals prior to movement. And then depending on their test results, we'll determine whether they're going into positive housing or negative, or what we're calling clean housing at this point. We had already started increasing the amount of cleaning supplies we put into each unit prior to our outbreak. That was 3 times a day after each meal we were putting those in. Since the outbreak, we are just leaving the cleaning supplies in each unit and replenishing the sanitation chemicals as necessary. For those units that tested positive, they have positive inmates in them. We've added jugs filled with Gatorade. We change those and clean those out each day. We've given them, medical staff is giving them Tylenol to keep on person, so as they deal with, if they want it, as they deal with symptoms that occur during the night or middle of the day when maybe there's not a med pass, that they can take care of that as well. We're also limited on court movement, only those that absolutely have to go to court since this broke out, and we've gone pretty much exclusively to video court in cooperation with the courts. The sheriff instituted early release policies under 8658 of the government code, and then subsequent to that, the courts, the presiding judge, actually is Judge Panetta, issued us a new modified OR policy that really mimics what the Chief Justice of the California Supreme Court had put out earlier this year in regards to $0 bail. So that is in effect right now as well. We are handing out masks. We have handed out masks to the inmates for quite some time now. We exchange those twice a week. As soon as an inmate comes into custody, brought in by a new arrestee, they're given a mask, and then we have staff that, again, twice a week are going around and exchanging masks, as well as giving additional soap to help encourage them to wash their hands more frequently. They can order soap on their commissary, but we are providing additional soap twice a week. Those areas that are positive are getting that soap 3 times a week. A lot of material to go through. I'm sure I've forgotten a number of things. I think those are the general highlights, and I'll be happy to answer questions at the end of everyone else's presentation. Thank you.
Thank you very much for that information. And yes, I think some questions are already starting to come in. We have Dr. Moreno on the line to answer questions. No presentation today, so I'll go ahead and start with questions. And my first questions are for Dr. Moreno, so we'll get going. Dr. Moreno, has the health department noticed a spike in coronavirus cases after the holiday weekends, for instance, July 4th or Memorial Day weekend? And if so, is there a thought that people traveling to Monterey County from other areas or large gatherings may contribute to that rise in cases?
Hey, good afternoon, Mia. So thank you for the question. So we're actually having a lot of cases that are actually not so much from weekends, but a lot of the transmission that's occurring is within the household, and that's what our epidemiologists are sharing with me. So that's where a lot of transmission is occurring. So people are, when they leave their homes, they're getting exposed somewhere, either at work or when they go out to stores. They're getting exposed and they're coming back and they're spreading it within their household. But certainly anytime we have a busy weekend here in our county, and people from various parts of the county and outside our county congregate in public places, and as it gets a little crowded, there's definitely potential for transmission in those settings as well. So it's really important for people to use the face coverings and do what they can to stay at least 6 feet away from people that aren't from their household. Yeah.
Thank you. And then another question for you. What is the reasoning for daycares and places such as the YMCA to be open, but not schools?
So the school closure is, the requirements that Monterey County must follow, as set by the California Department of Public Health, are basically looking at the risk of transmission between children and their teachers and between school staff. And right now, I'm not prepared to make a comparison between the school setting and any other type of settings in the county. What we have is direction from the California Department of Public Health. And so the transmission between the kids and between the kids and the adults and the staff is definitely a concern. And I think that's the main, and in the light of increasing COVID transmission and COVID activity and COVID cases in certain counties like Monterey County, the California Department of Public Health is saying that we need to start the school year with distance learning mode.
Thank you. The next question I have is for Karen Smith. This is about the joint press conference. Karen, what are the main topics of the hospital press conference on Wednesday?
So we will talk about a little bit about COVID in general. We'll talk about a little bit about the epidemiology and what's happening in the hospitals. This will be a very hospital-centric call, and a call to action from the hospitals for Monterey County.
Right, thank you. And then our next question is for Dr. Moreno. People are reporting wait times of more than 2 weeks for COVID-19 test results. And at the MPC testing site, people are being told to expect results in 10 days' time. Why is it taking so long to deliver test results, and how can the county contain the spread of COVID-19 if it cannot track active cases?
So I'll start with the second part of that question, then I'll get to the, remember to get to the,
Kind of a
the
long
turnaround.
question, sorry.
Try to get to the turnaround time. So there's actually plenty that people can do to, our community can do to slow the spread of COVID-19 while people are waiting for a test result. And that is when someone has decided that they, either in consultation with their doctor or on their own, decided to seek testing for the COVID-19 virus. If they have symptoms, then while they're waiting for the test results, they should isolate themselves and follow the recommendations to isolate for at least 10 days after the onset of the COVID symptoms. So if our specimen collection facility staff, whether that's a OptumServe or doctors on duty or one of our hospitals or one of our federally qualified health center clinics, for example, continue to provide that instruction, then people can get swabbed and then go home and stay in isolation while they wait for the test results. People really should not be, if they're sick, be out and about thinking that they can be out and about, and if their test comes back positive, then they'll isolate. They should isolate from the moment they have symptoms. So that's, I think, a really important thing that people and their providers and anyone who's collecting specimens should continue to do. If someone is sick if someone has symptoms and in consultation with a doctor or on their own, they decide not to seek testing, for COVID-19, it's the same advice, same recommendations. That is, if you're sick and you have COVID symptoms, you can assume that you have COVID-19 and isolate for 10 days from the onset of, at least 10 days from the onset of symptoms. So testing or no testing, the recommendations are the same. The benefit of getting testing, of course, is that if you're test negative, then you're much less likely to have COVID-19. You wouldn't have to remain in isolation. As far as the turnaround time, as more organizations are offering to collect specimens, the additional specimens are going to the same laboratories that are currently providing testing services to all the facilities that have been submitting specimens for weeks or months now. So the demand seems to be exceeding some of the laboratories' ability to deliver shorter turnaround times. And so that's definitely a concern for, in particular, anyone that might be waiting to make some clinical decisions. But again, as I get back to the turnaround times of 7 to 10 days, that's if someone has symptoms and they've waiting for a test result, they really should isolate themselves until they get their test results back. I think eventually there's going to have to be a combination of adjustments to testing over time. We're going to have to adjust to the demand by increasing capacity in our commercial labs, and we'll have to probably be more adherent to priorities that are set up by California Department of Public Health as to who should be tested and given priority, meaning tier 1 type of people who are hospitalized or being hospitalized, for example, and then prioritize those samples to be tested at laboratories that have the shortest turnaround time, and then go down from there. So I think we'll have to probably make make a little more progress in trying to adhere to the priorities that the California Department of Public Health has set out for testing.
Thank you, Dr. Moreno. Another question for you. Is there an update on COVID-19 deaths today that would suggest there is one more today, bringing the total to 24?
You know, I apologize. I am aware that I didn't ask my epidemiologist for any information on that individual, but I can get that information to you, Maya. Maybe you can share it with the media.
All right. Thank you. This is a question for Chief Bass. I hope you're still on the call. You did give a figure, but very quickly, how many inmates have been released in total?
Releases in total, I'm sorry. Let's see.
No, go ahead. Sorry.
Early releases based on the different avenues we have are 63. There's been much more than that overall, just common ORs, sentences completed. I don't have those exact numbers, just the early releases, which I detailed in there. There's 34 that we had an early release order that was signed by Judge Culver earlier this month, and it allows us to give up to 10% credit up to 60 days. I'm sorry, up to 30 days additional credits on sentences. There's been 34 people released that way. The government code 8658 releases that Sheriff Bernal put into effect on July 10th. There's been 26 from that. And then with the $0 bail that just went into effect last week, there's been an additional 3. So a total of 63 additional releases due to COVID.
Thank you. And how many staff have been tested, excuse me, how many staff have tested positive, and have all staff been tested?
So 11 have tested positive so far out of 271. And that does include our contract staff, deputy staff, civilian staff. We're not through everybody based on vacations and different times off. We have a few stragglers, but that is probably 95% of the staff that we have on site, our medical staff and kitchen staff and all of that included. So 11 out of 271, sorry.
Thank you. And how many total hospitalizations for inmates and then for staff?
So we've sent 4 inmates over to the hospital. One of them, I believe, was hospitalized for a day, but all 4 have returned. We sent them over for advanced care. And again, all 4 were returned. I have not been notified of any staff requiring hospitalization at this point.
All right, thank you very much. And back to Dr. Moreno for a question. Has public health released the additional demographic detail for hospitalizations and deaths yet? And if not, why?
Yeah, yeah, thanks, Mia. I thought we had, yeah, so on our webpage, we've been able to look at hospitalizations and fatalities, and we've been able to partly break those down. So folks can go to our website and see what we've done with the hospitalizations by race, ethnicity, and proportions, and then number of fatalities by race, ethnicity, and those proportions, and also how those proportions of hospitalizations and fatalities compare to the proportion of Monterey, of those race ethnicities among the entire Monterey County population. And we've also broken down the hospitalizations and the deaths by age. And similarly, you can compare the proportion of hospitalized cases by age and proportion of fatalities by age with, or begin to compare it to the proportion of each of those age groups among the entire Monterey County public health population. And then I did get some information on the 23rd death. It was an adult, and we're still, I don't have any more information other than the person was adult because they're still undergoing the investigation.
So 23 is still our number. I think the question was
Yes.
wondering if we're at 24.
No, 23.
All right, thank you. And that answers one question here. Back to you, Chief Bass. What is the current jail population?
Last night, the jail count was 710.
Thank you. And I see you've written it in chat, but we have a lot of people watching on YouTube, so I'm going to read the question and get the answer also. A question for Hillary. How popular has the use of your Wi-Fi bookmobiles been, or use of Wi-Fi outside the library locations? I'm interested in how many people are using those Wi-Fi options, if you know.
The Wi-Fi at our branch libraries has been very popular since March. They vary branch to branch in terms of how many, but usage skyrocketed. Absolutely, after we had to close the physical facilities. We have not rolled the bookmobiles formally yet. We're talking to each school district and each community to figure out the best times, dates, and lengths. So those have not rolled yet.
All right. Thank you. And are there any, that's all the questions that I have in chat. Are there, because as soon as I say that, I'm going to get one, which is perfect. I see Karen Smith has put in the hospital link to the hospitalization information and demographics that were asked about in chat for people who are looking for that. The question for Chief Bass: how many inmates will undergo a second round of testing?
Well, that's a great question. I don't have a figure for you. Going back, though, as I stated earlier, all of those housing areas where someone was removed that had tested positive, we will go back and retest. And that retesting is going to occur 11 days after the initial inmate that tested positive was found. And then if everybody is negative, we will do a second test 7 days later. So there will be 2 negative tests that they'll have to go through before we'll move them out of that, what we're calling observation housing at this point. I didn't mention that earlier, but that is a distinction. We're trying to be safe and smart about how we move individuals out that have potentially been exposed.
And also, are all the new inmates being tested when they arrive, or are they just being isolated?
So we just talked about that this morning. We are going to start testing those that come into custody and are staying with us. We're going to test them right away. They will still go into their observation housing for 14 days. However, if they test positive at that initial screening, we will go ahead and move them out into positive housing in the existing jail. There's no sense in leaving them in there for 14 days since we know they're already positive. If someone tests negative when they first come in, then we'll wait, and then day 11, we will retest them.
All right, thank you. Are there any other questions for any of our presenters today? I'm not seeing anything coming in. Giving it another second or two. Then thank you very much, everyone, for joining us today. That will end our media briefing for Monday. Well, our next briefing will be on Friday, and we'll see you then.
Thanks, ma'am.
Thank you.